Before we begin, we'd like to give special thanks to all of our sponsors for making this event possible each year. Specifically, thank you to CRL FormFox for being our title sponsor for 6 consecutive years. And thank you to our platinum sponsors, Psychmedics, OraSure Technologies, Quest Diagnostics, and Veriforce. Hello, and thank you for joining us for another session of Day with DISA. Today, we're talking about a drug testing update with a focus on safety in the workplace. Today, we're joined by Brady Quarles, Vice President of Industrial and Consortium Sales for DISA Global Solutions. Brady, how are you doing today?
I'm doing great, thank you.
Awesome. Well, before we jump into the presentation, I want to remind everyone that if you have any questions, use the Q&A button at the bottom right of the player to ask them. If we're unable to answer your question today, we will reach back out to you at the end of Day with DISA and get you your answer. Additionally, we're going to make a copy of this presentation available for download on the Materials tab at the end of the session. With that being said, Brady, the floor is yours.
Well, thank you again, Thomas. I would also like to thank everyone for participating in DISA's 6th annual Day with DISA. We're super excited to be here. To get started, we'll be taking the next several minutes speaking to why it's important for organizations to have a strong and robust drug and alcohol program that meets the needs of the company and even the particular industries that your company caters to. In addition, updated drug testing trends will be discussed, so fasten your seatbelts. We're going to get started. So we're going to go ahead and move forward here to section 1. Why are we here? The answer is pretty simple. We're here to raise awareness about illicit drug use and the challenges an organization will have with protecting their workforce. Also, we want to provide a blueprint for your organization on how to build a robust drug and alcohol program that covers every aspect of your organization's needs. Overdoses continue to break records. I always like to place this slide up front. As an audience, I have one ask. If you remember anything from this presentation today, let it be, let it be this, the next 2 slides, essentially. We'll talk about consequences of illicit drug use and how it can affect the bottom line of your company. But we also want to make the point that drug use in 2024 is more dangerous than it has been in years past. Looking at the graph, it clearly shows that overdose deaths have skyrocketed in the last few years. Illicit drug use is getting deadlier and drug use has been on the rise. As a nation, we had 98,000 overdose deaths in 2021. Wow. Overdoses were up actually 58% from 2 years prior also. How about going back 20 years ago? So in 1999, we only had about 13,000 overdoses. 13,000 overdoses compared to the 98,000 overdoses that we've seen in the recent past here. I mean, we're looking at a 781% increase. Scary times for sure. More hardship and despair will always lead to self-medicating and with the use of drug and alcohol. Unfortunately, this type of activity also equals probably more overdoses as well, especially when certain drugs like fentanyl, meth, and cocaine are making recreational drug use more lethal. Just for example, just kind of look at some of these numbers here. And when we look at drugs and fatal overdoses, it's important to know that this could be in multiples. And so an individual could have fentanyl and methamphetamines in their system at the same time here. But who are the big 3, obviously? I mean, you got fentanyl at 69%, you got meth at 32%, as well as you've got cocaine at 24%. So scary for sure. The stars of the show here are definitely those 3 for sure. Moving on, multiple drugs commonly being used. With this slide, we're still speaking about overdoses on a national level. Earlier, we talked about what drugs in 2021 accounted for most overdose deaths. With drugs like fentanyl and meth being, the star, like we said, I mean, it is what it is. As you can see, overdose deaths are increasing at an alarming rate when you compare deaths from 2 years ago versus even going back 20 years ago. So just a few highlights to speak to. We'll start with opioids. So everyone knows fentanyl is an opioid. So overall, overdose deaths from opioids have increased about 69% from 2019. That's just a few years ago. In addition to that, if you go back 20 years, back to the early 2000s, you're looking at a 1,008% increase. That's amazing. How about meth? Overdose deaths are up in 2021 by 104% from 2019. Looking back in time, one last time, we're seeing about 6,611% increase in overdose deaths, going from around 500 deaths in the early 2000s to almost 32,000 deaths in 2021 is very alarming. The last point that I'd like to make on this slide is pertaining to opioids and how it's always important to update your panel when new threats arise. In 2017, expanded opiates were added to the DOT panel. The markers were actually added because those types of drugs were becoming a problem. What we saw was, high positivity rates for these types of drugs, and so people started adding those types of drugs onto their panels. Now, what we see now is we have a new opioid in fentanyl that is killing people at unprecedented rates. Does your current policy test for fentanyl? I'd say more than likely not. If not, get with your TPA of choice and make the necessary changes for the newest threat. Moving on to fentanyl concerns have not slowed. It's important to know that fentanyl is the #1 cause of death for workforce age adults in the U.S., ranging from the ages of 25 to 54. So, what is fentanyl? Fentanyl is a synthetic opioid. We talked about that a little bit, but it's about 50 to 100 times stronger than other opioids like morphine and heroin. Pharmaceutical, fentanyl was initially developed for pain management treatment of cancer patients. Because of its powerful properties, fentanyl is also diverted for abuse. For example, fentanyl is added to heroin to increase its potency, or to be disguised highly, as potent heroin. So we see that a lot. In most situations, users believe that they're purchasing heroin and or another pharmaceutical drug and don't know what they're actually purchasing something that includes fentanyl, which obviously a lot of times it can result in overdose deaths. Pretty scary. You could say that fentanyl has made using certain types of drugs like playing Russian roulette. The drug users don't know exactly what they're taking. In most cases, the fentanyl is, coming from, China to Mexico, and the cartels are combining it with other drugs for the effect. As you can see, I would say with this is quality control is an issue here. Fentanyl isn't a type of drug that's regulated at all. These drugs aren't coming from Pfizer, and so they're very dangerous. I guess one last note of importance, we mentioned that fentanyl accounts for a large number of opioid overdose deaths in the United States. In fact, it's nearly about 90% of those 76,000 opioid overdose deaths that we're looking at right now. So very alarming to say the least. Historical positivity rates by test. And so, I work for an organization called DISA, DISA Global Solutions. DISA performs several million drug tests per year. So I'd like to kind of provide a few drug testing trends broken down by reasons to test, for example. We'll get into the weeds a little bit about reasons to test later and what that is and what they are. But what you're looking at here is non-DOT positivity rates broken down by 3 different reasons to test here. And the graph compares essentially positivity rates starting from 2018 to the present 2023. So, with the slide, I wanted to point out a few details to take a note. Basically to start out. On the far left, we're comparing positivity rates for random testing for the 6-year period. In my opinion, random testing is one of the most important types of tests when it comes to identifying and preventing illicit drug use within an organization. When an employee knows that they could be pulled for a specific random at any time, they are more likely to abstain. And that is basically why low positivity rates a lot of times happens with random testing. On another note, it isn't a coincidence that the highest rates for the random testing happened in 2020 during COVID-19. Now those positivity rates are stabilizing, and that's what we're seeing right now. How about pre-employment testing? By far, pre-employment testing is probably the most prevalent test of testing out there. Most companies are testing applicants before they're added into the workforce. What do the trends kind of look like for pre-employment testing? For the most part, we see that these positivity rates are static leading into 2020. After COVID, we continue to see a rise in positivity rates to where, we hit 3% for 2022. Pre-employment positivity rates are, up 20% since 2018. So obviously the trends are going up. At the end of the day, overall positivity rates for all reasons to test are trending up. I mean, we're up 12%. Last year, I think we were up 10%. So we're definitely going in the wrong direction there. Next, historical positivity rates. Essentially, what we're looking at here is corporate employees. And, we feel like, and this is surprising to some people, but corporate employees are more likely to abuse. How about we kind of just take a look at the non-DOT random positivity rates for a few different types of drugs in the same time period, and that way we can kind of just explore and kind of take a look at the trends there. So, looking at this, the focus here will be, will be corporate non-DOT employees. These aren't employees working in the refineries or working on the pipelines. These are people working in sales, IT, finance, inside corporate potentially. Starting with marijuana, and this is no surprise, but minus a small dip in positives in 2021, marijuana positive rates continue to rise. Environmental challenges affect this, but public opinion on marijuana is changing, and marijuana is much more socially acceptable than it was in the past, and we'll talk about that a little bit more as well. States across the country are now allowing medicinal and recreational use. These numbers will continue to climb. How about pharmaceuticals? Let's take a look at opioids and amphetamines. On the chart, positivity rates for amphetamines and opioids are on the decline since COVID, but they're flattening at elevated rates. And so static year-over-year positivity rates is what we're seeing here for these pharmaceutical drugs. But, once again, the positives are much higher than what we saw back in 2018. So I guess higher positivity rates are becoming the norm. All in all, I would say, like all positives for opioids and amphetamines. I mean, they're up drastically. I think they're up up over 350% when compared to 6 years ago. We'll talk about those challenges a little bit later that comes with the increased drug testing. But what we're going to do now is move on to marijuana. Marijuana legalization, public opinion. With this slide, I want to make it a point to the individuals, basically a point that individuals' thoughts and beliefs about specific drugs are evolving, and it's been evolving for a long time. The evolution of these thoughts and beliefs can make your job, managing your drug and alcohol program and keeping your organization drug-free more challenging, that's for sure. So just kind of taking a look at this, we can take a look at 1969, only 12% of all adults supported legalization of marijuana. Since then, support for legalization has increasingly increased. And in 2022, most American adults supported legalization. I think we're right there at 70% there. So pretty interesting for sure. If we're looking at the graph, obviously on the horizontal side, we've got the age groups, and the vertical axis, we're looking at percentage of people that support legalization. Just a few last takeaways here. The younger you are, the more likely you are to support legalization. Surprise, surprise, and more than likely that didn't surprise anyone there. One other thing, just looking at the steady climb from 1969 to 2022 and 23, that the percentage of Americans that actually support legalization, I mean, it's increased. I mean, big time. We're talking 58% in the last 20 years. Who knows where these numbers, what these numbers will look like in the future. I would just say, let's make sure that your company is prepared for the changes that are coming. And you're going to want to know you're going to want to know a little bit of an idea of what these changes look like as well. So That's a good place for us to move on, but the state of marijuana legalization. Looking at the map, a state that deems marijuana fully illegal is represented by the color white. The darker colored states represent states that at least have some form of marijuana legalization. Going back 6 or 8 years, most of the map, would have been in white, representing the fact that, marijuana was fully illegal in most states. Now the entire West Coast, has legalized, and the East Coast isn't far behind. In addition, almost all states, minus a few, have some form of marijuana acceptance, and it's changing on a yearly basis and sometimes on a monthly basis. So, with that being said, the thought is, what will the United States, what will this map look like in the future? More and more states obviously are moving to legalizing marijuana in some form. Right now, what we're looking at, we have 25 current states that have fully legalized marijuana. I think where we were last year around this time was 19 states. And so, we definitely have changed. We're seeing new rules and regulations in California, Washington, as well as the states in New York and New Jersey as well. Things are changing quickly, and it's going to be a hell of a ride. So I guess lastly, obviously concerns in some states are now removing employer protections for organizations that are testing for marijuana in non-federally regulated job positions. We mentioned New York and we mentioned New Jersey. In my mind, it's kind of interesting to ask the question, what does the removal of employer protections mean to you? Essentially, in my mind, it means that you don't have the ability to penalize an employee if if the individual tests positive for marijuana. Also, California law has changed, and testing for marijuana is going to be more difficult. The California law specifically prohibits employers from taking adverse employment action against employees for their off-duty marijuana use. We'll talk about it a little bit later, but there are some challenges with it, with the specific methodologies that drug and alcohol testing TPAs use. So, talk about a strange new world that we're living in right now. Identifying individuals that are under the influence of marijuana will be needed for the future. It's always going to be there. But in the drug testing world, technology needs to evolve to give us more capabilities. So moving forward, marijuana facts and figures, just kind of looking at the information, what kind of jumps out here. 2017 to 2023, we're seeing a steady rise in marijuana use. Positive marijuana drug tests are up 50%. Looking at the most up-to-date information between 2022 and 2023, positivity rates are up around 10% in the general workforce. If you include safety-sensitive jobs, this will increase. One other note, I guess I'd say, is in states that have legalized marijuana, and we just talked about a few, states like California, Washington, New York, New Jersey, Colorado. These organizations, we're seeing positivity rates that are far outpacing other states that aren't fully legalized. And so that's something that probably shouldn't come to any surprise from anybody. To finish up, our discussion on marijuana, I want to reiterate that the challenge of managing a drug and alcohol, program will become, it's going to become more difficult with the further legalization of marijuana. The way I've always looked at it is alcohol is legal, but the substance still has its effects on the workforce. Marijuana is the same. Let's just make sure that marijuana use and being under the influence of the substance is prohibited in your policy, and you're always testing for it when and where you can. And so that's a big part there. Test for it when you can. So, one other thing, why should you prohibit? And this is, kind of what we we're talking about earlier it's like alcohol has a number of side effects. Just a number of those side effects lead to disorientation, confusion, memory loss, blurred vision, things like that. And so whether you're working at a desk or working on a crane, that's not something that you want your employees to have there. So moving forward, consequences of drug use in the workplace. As most people know, actions always have consequences. When it comes to drug and alcohol use on the job, the consequences can be costly to a company for sure. In addition to monetary losses, people can get hurt or they even lose their lives in certain situations. So, as an organization, you're going to want to know what the consequences of drug use in the workplace are and how these actions, can affect your company. And so, just kind of just throwing a few out there. Obviously, when you think about consequences, always think about poor work performance for one thing. That's always a big one, and what that looks like. I mean, that could be a number of things there. Employees with lack of focus, poor decision making, increased absenteeism. That's kind of a big one. Individuals that abuse substances are always more inclined to call in sick from hangovers or other ailments specific to substance abuse. If you've been a people leader for a number of years, I think you've always seen that you probably have more people call in on absent on a Friday or a Monday. A lot of times, I think that's based off of individuals having too good of a time. But just my thoughts there. How about monetary consequences for the organizations and for your organization? We talked about increased turnover. With increased turnover, you must talk about the increased time and money that it'll take to train and onboard your replacements. And so you invest time in your current employees before you know it, they're gone, and now you're having to start over again. So it can be challenging. Theft, illicit drug users will also, will often resort to stealing in order to support a habit. Substance abuse can make decent people make poor decisions. And so always be mindful of that fact and continue to drug test people after they've been hired. So, definitely random tests. We can talk about random testing a little bit later. Lastly, accidents. These accidents can lead to loss of life and or equipment or both. Any actions that impact a person's judgment, or their alertness or their perception, could lead to trouble. So, all right. Well, cost to employers. With this slide, what we wanted to show the group was illicit drug use and, drug and alcohol use cost companies on a national level. Additionally, we'll answer the question about if drug and alcohol abuse is a factor in work-related fatalities. Just looking at costs here, and this is just a lot of information, but I feel like it's good information. U.S. companies lose about $1 billion annually on drug and alcohol-related abuse. If 17% of the workforce is considered substance abusers, what we're looking at is we're looking at probably each abuser potentially costing their company about $7,000 a year. Absenteeism. Substance abusers are 5 times more likely to be absent. Abusers account for 35% of all of the absenteeism within the U.S. We also mentioned performance issues with substance abusers. Substance abusers are generally about a third less productive, and so that's also interesting to know. Lastly, theft. Theft in the workplace can harm a company's bottom line. Substance abusers typically account for about 40% of all thefts reported, by organizations. And so, companies are obviously affected by illicit drug use. As a number of people know, attending the webinar, the company that I work for has thousands of safety-sensitive focused clients, and so we talk with them all the time. DISA believes that illicit drug users in a safety-sensitive setting will cost their companies even more, and I'd say even a lot more. And we believe that the annual costs per year is more like $35K annually for these safety-sensitive users, and so that's huge. That's about 400% increase from the normal non-safety sensitive workplace estimation there. And so just a few things to kind of think about there. So next slide, DISA's current THC recommendation, and I think that probably a lot of individuals on this webinar are curious about this. But one thing I'll say is before we start, this new section in a few minutes, I do want to talk about your options for building a robust drug and alcohol program. I wanted to briefly speak to the question that everyone is probably thinking. What is DISA's current stance on THC, and how should organizations handle it? First, what I'll state is I'm not a lawyer at all, and this is not legal advice, but it's very important that your legal counsel is staying on top of of the subjects. As we talked earlier, always test for marijuana when and where you can, because it's so impairing. But definitely know the particular states that might pose a challenge for you when it comes to testing marijuana. States like New York, New Jersey, California come to mind. Obviously, a corporate drug and alcohol policy will rarely ever consist of just one particular policy, and so carve outs for specific employees that could fall under DOT regulations and states that shouldn't test for marijuana should always be considered. There's not one silver bullet when it comes to a drug testing policy. Multiple policies could and normally are needed in order to meet all your specific needs. Your specific needs could be coming from your internal organization, obviously the Department of Transportation, as well as some of your clients as well. So moving on, we're going to go ahead and head into section 2, understanding your options. What can you test and when? And we'll go ahead and kind of start with drug testing methodologies. There are different methods used for drug testing. These methods differ in terms of cost, accuracy, and intrusiveness, and where they can be administered even. Each test looks for chemical metabolites or traces of a specific drug that it leaves within the body. The 3 main drug testing methods that DISA and other third-party administrators specialize in generally are urinalysis, hair testing, and oral fluid testing. Methodologies in many ways, just so you know, like I said, they differ in many ways, but all types of testing have common denominators in what they are testing for. Next, when you're looking at the specific, policy and what you're looking for, you're going to want to kind of get more of an idea of, when are you testing potentially? So when are you testing? Just a couple of examples. You've got pre-employment. Pre-employment is when you screen applicants and future employees before they come aboard. Offers from an organization almost always hinge on the results for these types of tests. Using a long-term methodology like hair to detect habitual users is also recommended in these pre-employment situations. I'll speak to random testing as well. When I've mentioned this a little bit earlier, but when as an organization, you got to ask the question, will you randomly test your employees? DISA does suggest that you randomly test all of your employees. Higher random percentages are always recommended for safety-sensitive job functions, but even your internal corporate employees should be, subject to random testing as well. So, once again, why random tests? In my mind, a random test is the biggest deterrent that a drug program can have. As an example, we'll pick on John Doe. John Doe knows that he won't be tested after the pre-employment process. So he basically has a green light to use drugs in the future. He's an illicit drug user, and he's definitely going to continue to do that. But that's not that's not what you want, obviously, when you're building a culture of safety. You want the ability to test randomly at any given time to have that deterrent. So, as an organization, I'd say that you want to have a clear view of what kind of substances that you are screening and, how you'll screen for them. When you're looking at drug testing policies, you'll notice that, the tested substances are usually classified as panels. Just a quick little definition, the term panel refers to the drug or family of drugs included in a specific drug test. And so what you'll see there, and you'll see that on the far right there, is you have a 5-panel and you have 10 panels. And so the 5-panel that you see in the middle there, that is a DOT mandated 5-panel. So they're testing for 5 specific drugs. those 5 specific drugs are tested, there are added markers for expanded opioids. And then on the far right, you've got a 10 panel there. Just so you know, any 10 panel, I would say 99% of these 10 panels, they're always going to include at minimum what DOT requires. And so marijuana, amphetamines, cocaine, opioids, and PCP is going to be included. And then they're adding the pharmaceuticals, the barbiturates, benzodiazepines, propoxyphens, and methadone, things like that. So just a quick point there. Most common drug testing methodologies. What we're looking at on this slide is detection windows for a few of the standard drug testing methodologies used in employee screening. We have urine. Urine, basically the detection window there is basically a few hours to up to about 7 days. Oral fluid, your detection window is anywhere from about 2 hours to potentially up to 24 hours. Blood testing, blood testing is not normally used in normal testing situations due to the intrusiveness, but it can be used in post-accident situations. So blood testing provides immediate detection up to a few days, but it's rarely used, and typically you're going to have to send somebody to a hospital. Lastly, you have hair testing, which provides a long-term detection. That detection window for hair is essentially a week to 90 days. So, all right. Moving forward to industry best practice. I won't spend a lot of time on this slide, but I wanted to pass along, 18 years of experience helping organizations build their drug and alcohol programs. All methodologies have their advantages and disadvantages, and I've kind of said that, but, multiple barriers are always needed in order to protect your workforce and property. What we recommend and what I recommend is that a client use a combination of short-term and long-term methodologies. What that does, it helps you create a robust drug and alcohol program that provides the ability to identify, if an individual has something in their system, the short term, and most importantly, in the long term. The way that you do that is, and if you're looking at reasons for tests, for example, at pre-employment, what I would suggest is do a combination, do 2 types of drug tests for those individuals, urine tests or short-term detection that could be urine or oral fluid, and also a hair test. That hair test is the long-term detection there. Random is, you can perform that with either urine or oral fluid. Post-accident reasonable suspicion, urine, oral fluid is something that you could use as well. So moving forward with historical positivity rates, just a couple things, I'll mention here, and some of the highlights by just looking at this is, the increase of positivity rates when you go from a 5 panel to a urinalysis 10 panel is high. So what that tells you is testing for more drugs almost always leads to higher positivity rates. And so if you decide to go with urine, and like I said, and this is non-DOT, DISA, as well as myself, are always going to recommend testing for more drugs versus something like a 5 panel. Once again, I would say if you're, I've mentioned this earlier, but if your employees fall under DOT regulations, they will need to test under, a DOT 5 panel. But these employees can also be included in more stringent non-DOT corporate policies as well. And so, you can subject your employees to more stringent testing, dual testing if needed. Lastly, how about the pre-employment positivity rates for hair testing? As I think it probably surprises a lot of people to take a look at that. But the 5 panel hair actually has a higher positivity rate than other programs due to the longer detection window there. Hair testing is a great methodology for detection of drugs that metabolize quickly. A few examples are drugs like cocaine and amphetamines and even opioids as well. Going into section 3, and this is actually the last section, so I'm sure a few of you are tired of hearing me talk, but to move forward, understanding state laws, I'm certainly not going to dive into all of these numbers just for time purposes. The key thing to take away here is that you have to understand state laws. every state is changing and they have their own little caveats. States have different challenges from unemployment, compensation, and case law. Also, different industry impacts, what is safety sensitive and what is not. And so that's always something to consider. Make sure that your internal counsel is reviewing your policies on a normal basis. State laws are changing fast, and it's worthwhile to explore having multiple policies, based off of, where the employees are always working. So, if you have a location in New York, New Jersey, or even California or Washington, for example, definitely be taking a look at, basically state law there, and you might have separate policies for those individuals, just depending on what your abilities are in those states. So step one, defining your drug testing policy. The first step of building a drug policy for an organization is to identify what methodology or methodologies are needed in order to meet your organization's desired results. And so obviously, federal regulations might require you to test a certain way in some situations, but other drug programs, could consist of multiple policies with different methodologies used at different times. So, once again, the most common methodologies in drug testing are urinalysis, hair, and oral fluid. DISA, we recommend, a combination of the short term and long term. We've already talked about that. Next for your organization, what I will kind of add as well is your organization will need to identify and determine what types of test purposes will be needed. We've already discussed the different reasons to test, but know when a drug test will be needed in your policy for sure. So, to touch base on another best practice, let's make sure that your organization is sending all tests to a laboratory for analysis. Sending your specimens to a SAMHSA and CAP FDA certified laboratory will save you in the long run with any potential legal litigation. So it's always suggested. Specimens should always be sent to a medical review officer as well. A medical review officer, which a lot of people call MRO, is a licensed physician responsible for reviewing lab test results from an employer's drug testing program. The MRO must have, knowledge about the pharmacology and the toxicology of prescriptions and illicit drugs, as well as federal agency drug testing regulations and guidelines. So that's super important. Lastly, when you look at an MRO, I mean, their primary duty is to monitor and determine lab test results, including medical explanations and laboratory confirmed positives, with positives, adulterated or substituted items, potentially. Additionally, they must ensure the timelines and accuracies of drug test results for the employer while maintaining the utmost confidentiality. So that's always important. The MRO is not just there for the employer, but it's also to protect the employee as well. With that, step two, clearly document policy and policies. Long story short, your drug policy needs to be clear and concise about what behaviors are prohibitive. For example, alcohol and marijuana are legal in some instances, but you want to make sure that you prohibit the use of the substances, at your workplace. Make it clear in the policy that employees shouldn't be under the influence of the substances while at work. Next, make sure that the parameters of the drug testing program are included in the policy. So, and we've kind of mentioned this here and there, but once again, how is the company testing? What methodologies are they using? When does the company test? And so the reasons for tests, for example, pre-employment, random testing, post-accident, reasonable suspicion, number of options there. And lastly, what drugs is your organization testing for? Some of the examples there are marijuana, opioids, cocaine, amphetamines, and now fentanyl are options. And so whether you're doing a 5, 10, 11 panel, it's always important what those panels are. I would say, once again, we've talked about it a little bit earlier, but fentanyl is a big problem for the present and for the future as well. If you're not testing for it, it's probably a good idea to start having some conversations with some individuals within your TPA. So I guess one other thing is another question for your organization is what are the consequences of policy violations for your organization? You're going to need to know that. Will you allow rehab and let employees come back to work once they've completed the return to duty testing? Or does your organization believe in zero tolerance? Zero tolerance essentially means, what it sounds like. Basically, is rehab is not allowed in the event of a positive drug test. Termination of the employee will follow. So, one other thing, we spoke about policy, the policy itself, but an organization also needs to determine if a medical disclosure policy is needed. In most cases, it's always going to be recommended, especially in safety sensitive, situations. Many people use legally prescribed drugs without failing a drug or violating company policy. And the DOT specifically states that the age of the prescription cannot be considered in the review of that positive drug test. So, a medical disclosure requires employees to self-identify with their employers that medications that they might be on before they're sent out into the workforce. So, it's important to know that medical disclosure policy is important in these situations, especially for safety sensitive situations. We don't want John Doe working on a crane when he's using a illegal opioid on a work site. Illegal, and legal drugs could pose a threat to workplace safety. If you don't already have, like a medical disclosure policy in place, you may be opening yourself up to legal drug use on the job in your safety sensitive positions. And so that's not good. So that's just something to think about. Finally, step 3, employee education and training. As an organization with a newly created policy, what's next? Once the policy has been created, it's important that your employees are educated on the specifics of the policy. In many cases, HR teams will perform policy reviews for the employees. Policy updates will also need to be had when changes are made to your current testing policy. So, companies can also provide specific trainings that will provide educational material. And we see that all the time for employee training. I would recommend an employee awareness training for all employees. Employees need to know what substances and actions are prohibitive, while on the job. Most importantly, they need to know the consequences of violating the policy with, positive tests or even a refusal to test potentially. How about supervisors? Supervisor awareness training, will be important and it's necessary in some situations. Giving your supervisors the knowledge of how to identify illicit drug and alcohol use is vital. And some of the things that you're looking for, obviously, you're looking for at physical signs. You're looking for those. That could be bloodshot eyes. That can be unsteady walks, shakes or tremors, things like that. Behavioral signs, attendance, tardiness, things like that. And finally, psychological signs and explain changes in personality or attitude. These are definitely things that need to be looked at and documented potentially. So moving forward, educating the supervisor on program processes and procedures, including documentation requirements are a must. For example, document all signs and symptoms leading up and during the reasonable suspicion drug tests. If an employee is sent off site for a reasonable suspicion drug test, please, do not allow them to drive themselves. We've heard about this before, especially if it's in a company car. This increases your ability, your liability because you already believe that the individual may be under the influence there. So, I would say lastly, just to kind of finish this up, I feel like it's always a good idea to have your employees sign off on, on the policy for verification that they have reviewed and understand the consequences of the program. Even when small changes are made to the current policy, a new signature sometimes, could be attained. So just a few things there, also, we covered a lot of material today. Some of the few of my last thoughts here, basically, developing and managing a drug and alcohol program is challenging, and it's only getting more challenging. As the drug use in America evolves, your drug and alcohol program needs to evolve with it. One suggestion I would have is just don't be afraid to adjust your drug and alcohol program. Especially when the landscape of our nation's drug abuse changes, or it changes, on a yearly basis. If you identify a new threat, work with the individuals around you and act on it potentially. And that concludes my presentation. Hopefully I've provided you with information that will help you in the future with your future screening challenges. At this time, feel free to submit questions. I'll address as many questions as I can. In the event that I'm not able to respond to your question in the allotted time, future communications will be sent out.
Well,
Thank you for your time, everyone.
Brady, I know we're really tight on time, and we've got a hard out. Just one question I've seen a couple times. If fentanyl's killing so many people that are using it, why should I test for it?
So the reason why you test for it, because there's definitely individuals out there that are not dying from it. And what we're hearing from the laboratories that there is, from the few organizations that are actually potentially testing for it, there's high positivity rates. And I think these organizations want to know what's happening with their employees.
Well, Brady, again, I know we were tight on time. I appreciate you clearing some of your schedule for us today. I know we weren't able to answer all the questions, but we'll reach back out to everyone next week after Day with DISA. And again, thank you so much for being a part of another session.